Hey everybody, thanks for joining us again. We are live for day 2 of Facebook Live Week. We are talking to some of our health, science, technology programs today. I'm here with Christine Ferrier, our phlebotomy instructor, professor, and chair. Thank you for joining us.
My pleasure. Glad
Tell
to be here.
us a little bit about what phlebotomy is and about the program here.
Okay, so the phlebotomy program is a 2-semester program. The first semester, the students come into the lab and learn how to stick each other on each other. They, on the second semester, they will actually go out to the clinical sites and stick patients. They'll have probably 150 hours worth of time out in the clinical sites and get anywhere from 100 to 300 sticks for that second semester while they're sticking. The the program does include the Grand Strand and the Georgetown campuses, so we try and incorporate all the campuses so that way even the students that come from, as far as Charleston or, south, they have the opportunity to get the phlebotomy as well. After the second semester, after they do their clinical rotations, they will actually be able to take a national exam and then be able to get a job right after. They will be employable after that second semester.
Okay. And you've got some great relationships with our local employers in the medical field.
They only hire Horry-Georgetown technical students. I have students coming in from other programs. They won't even look at them. They only take Horry-Georgetown students. I had one student actually show their national certificate to the lab director, showing that they graduated from another facility, and the lab director said, no, we only take Horry-Georgetown technical students.
That's great.
Because they're trained here. You see the facility here. It's a great facility that we have to work with.
Right.
And they know that with the clinical hours, they have their practice.
That's awesome.
Yeah, they're going to get their practice.
Right.
So they look forward to them. And they actually have some of the students working even before they graduate.
Right, great.
Yeah.
Well,
So
show
and
us
we
an
have,
example
yeah,
of
we have
what we
Marissa
did?
here, and Marissa's gonna go ahead and show us how we do it. So Marissa is a first semester student, and she has, this is now our 8th week, 9th week in a 12-week program. So they learn how to palpate the vein, tie the tourniquet, and then stick it. So she felt the vein. She's gonna go ahead and clean it. No pressure here. But Marissa's excellent. Everybody likes when Marissa sticks them.
So if you don't like blood, this is not the career field for
Well,
you.
let me tell you about that. We
Don't
have,
want it.
every semester we have students that say they hate blood, they can't, do it. We actually had a student in our other class, our Monday class, that actually fainted her first day. We didn't even know she was gonna be, react that way. She didn't know she was gonna react that way. Fell, but then we worked through it. She loves it. She's gonna end up doing really well in the class. But every semester we have students that are afraid of the blood or afraid to get stuck. But we teach them how to, deal with patients like that, because they're gonna actually have patients like that out at the site. So Marissa's doing an excellent job. And so is Lacey. Lacey is the volunteer, so we have to give kudos to her as well. Great job.
You want that for me?
And part of all of our health sciences programs is to teach that kind of customer service, patient care interaction, not just the technique, but how
yes.
to make a patient feel comfortable. And
Yes, and they learn all of that in class. And they are great with each other. When there is a student that is uncomfortable with it, we gather around, because that's a great, we always say great teaching tool and learning tool. They will actually learn how to talk to the patient to make them feel more comfortable with different tools, so that patient doesn't feel such anxiety. Because if a patient's anxiety levels go up, that means it's going to also affect their test levels or the test results. So we want to make sure their anxiety levels are down. But the students end up really loving, I think really loving this class. They bond because they have to stick each other, and they have to get up close and personal. So the first day we introduce each other, and by the end of the semester they're friends. I would say that they're all friends in here, and it's really a nice close-knit group.
Great. Well, thank you. And we do have a student that we'd like to talk to a little bit, Phyllis McMahon, correct?
Yes, correct.
Tell us a little bit about why you chose phlebotomy.
Well, I started with HGTC for a career change. I was
was a paralegal for 30 years, so I decided to go into the medical field. And how I got into phlebotomy is I was using it as a stepping stone for another program that I have since changed my mind, and I want to be a phlebotomist now. Because I know there's other opportunities that go along with that. And I have to tell you, I'm going to do this, and I'm going to put her on the spot. Professor Farrier has really, I was very intimidated by this class. She has really prepared us. The reason why we have bonded is because of her and her teaching skills. So I have to tell you right now, I think I've overcome some of my fears, and they do exist, and they will exist if you get into this program. But I feel really good about it now, and we are very close, and so that's where I am right now. I hope to obtain my certificate through NHA, and so I'm excited.
Wonderful, thank you. So you're a great testament to somebody that
An
started a
elder
little bit later.
that wants to
Yeah.
start school later in
Yeah.
life. Yes, you can do it. There's no reason for you not to pursue another career.
Absolutely.
And this is the type of skill too, it doesn't matter how old you are, how young you are,
Absolutely.
what country you're from, none of that matters, because this is a skill-related, program. And all you have to do is learn the skill.
Absolutely.
Yeah.
Well, thank you guys so
Yeah,
much. I'm
our
always so
pleasure.
impressed with everything that you do.
Oh,
So.
thank you.
Thank
We
you for
enjoy
coming.
it.
Thank you.
All right,
Thank
now
you.
we're going to keep moving. We've got a very active session right now. We're going to go talk to our brand new program, Respiratory Care. Here. So I'm here with Sherry Tanner. She is the chair professor of our brand new Respiratory Care program. So tell us a little bit about what Respiratory Care is.
Well, Respiratory Care is a new program that's come to Horry-Georgetown Tech that we just started. The program is going to be starting in fall 2017, and we're accepting applications right now to get our first round of students for the start of the fall program. Respiratory therapists, we work all over the hospital with patients from newborn, premature babies, adults, trauma patients, elderly patients. We're utilized all over the, in different office buildings and using diagnostic testing. So it's a lot of interactive, high impact, quality jobs that work with patients and very much utilized in the hospital system.
That's great. So you have a lot of options, both in the type of people that you work with and in the setting that
Yes.
you work with. And you're still making a huge difference in what you do.
It's
because
a
you're helping
very-
people
yeah.
breathe, right?
Yep, it's a very
Awesome.
exciting job to work with patients, not only with breathing issues, but traumatic events, emergency calls. We're utilized there, and we help patients breathe, and we want to keep them breathing. So
Yep.
it's exciting to be have that responsibility.
Right, that's great. And you also have a lot of great connections with local healthcare
Yes,
employers.
we have contracts, affiliates for our students to have clinical sites with Grand Share Medical Center, Conway Medical Center, McLeod in Florence, Loris, and Seacoast, as well as Thailand's Health Systems.
Mhm.
We use Waccamaw Medical Center as well as Georgetown Memorial Hospital. So we have a good broad range of clinical sites that the students can build bonds with them as students, and when they're finished with the program, they can get hired with those facilities.
Great, that's
Mhm.
awesome. So I can't remember if you touched on this or not, but how long is this program?
It's a 5-semester program, 2 years.
It's a degree.
Yes, it's an applied associate's degree in applied health science.
Great. And
Yeah.
there is an actual application deadline.
Yes.
Which is different for our programs, but what is that deadline?
Yes, because we're a new program, and we have extended the application deadline to the end of July for new applicants, and we're accepting the first 16 students of the highest qualified, so it's a limited access program, and we're going to be starting August 28th with the first round of students.
Great. So make sure you get those applications in if you are interested. Comment on this section if you have questions, or click on the link that's in this description, and it'll take you to all of our medical technology programs, including respiratory care. Thank you so much, Sherry.
Thank you.
All right, we're going to move again. I'm actually going to take the iPad to hopefully make it a little bit safer for everybody. We're going to run downstairs to our EMT lab. So don't forget, like or comment to have your application fee waived. And again, click on this link. We're only covering a very small handful of health science. You want to see what the rest of them are? Bear with us for 1 minute. All right, and here we are in the EMT lab. I'll give this camera back.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
So I'm here with John with the EMT program, and you guys are doing skills.
This is their
test
EMT
today?
skills lab.
Okay. So talk to me about the EMT program that we have here.
The EMT program is 2 semesters long. It's the entry level program in the EMS. It's basic first aid, oxygen administration, splinting, that kind of stuff. So it's 2 semesters. We offer it during the day and evening as well. We have pretty much 100% job placement for those that are looking for jobs as they come out. And then they can advance on the program if they wish to from there.
Right.
So what you see is them all just practicing all their skills. At the end of the 2 semesters, they're tested at a national level for national certification as well.
Okay.
So if they want to relocate somewhere else, they have that ability as well too.
So is this the first semester or second semester?
It's the second semester. This
So
group will
these
test in
semester.
August.
Okay.
So they're just about ready to test and get a job.
Sounds good. Thank you so
Thank you.
much. All right, we're going to step out in the hallway real quick for our last little bit. All right, so I am here for our last little bit with Scott Sabanowitz. He is our department program chair over all of these programs that we're talking about. We've got 2 more things we want to cover, patient care and CNA. Talk to us about those.
So we have a patient care medical technician program, which ultimately will allow people to come in with no medical knowledge whatsoever, and it'll allow them to enter into a healthcare field at an entry level. So with our patient care technician program, we have the CNA program, which is a 1 semester course, and CNAs are definitely in high demand. All the hospitals are definitely looking for them, nursing homes. So those people can get immediate job placement once they complete that course. We have a patient care technician course that's a 1 semester course as well, which they can work in doctor's offices as a patient care technician or a clinical medical assistant. Again, those are all just 1 semester courses. There's an EKG technician course that we teach as well, which ultimately will allow them to do EKGs potentially like in a cardiac office or pre-admit testing potentially for surgery, or even in a hospital center where they have monitor technicians who watch the heart monitors on patients. So you can take all of those courses and become certified in all of them and ultimately get a patient care certification from the college. Or you can just take one of those 4 aspects and potentially go out to the workforce after 1 semester of education.
That's great.
So definitely make them workforce ready in a short period of time.
Right, and a great way to get your foot in the door in the medical industry, which is
Absolutely right.
clearly booming.
So
right
if you have aspirations for other career choices like nursing or radiology or stenography, potentially they're going to want you to have some patient care experience before going into those fields. So it definitely is an entry level into potentially some of these other programs, but it'll also serve to get you some of that patient care hands-on experience that you'll definitely need when you go into those fields.
Great. Awesome. Anything else we want to touch on?
I think that's
Thank you.
it.
Got it all? Thank you so much.